Emergency room visits are predicted to increase. Why? Because of Obamacare. The president promised that the health care law would reduce ER visits. In fact, just the opposite is expected. Why? Under the new law, more Americans are relying on Medicaid, and studies show that Medicaid participants use emergency rooms more than the uninsured. Meantime, in California, the enrollment problems continue.
We're getting phone calls galore, and we can't give answers.
Countless numbers of Californians have made the effort to sign up for a health plan, some spending hours at a time, but failed because of problems with the website. But like most bureaucrats, Peter Lee, the director of Covered California, told me on Monday, everything is going well.
Some people had rocky points at different points in the last 3 months. For the vast majority, they actually tell us the enrollment process was easy. Now, that's not everyone, and we want to make it work for every single person, but you got to remember that there's hundreds of thousands using this enrollment system, many of whom say it's working really smooth. They get on and off in 15, 20 minutes.
But the numbers suggest otherwise. 1 million Californians have accessed the website, but only 400,000 actually signed up.
More bad news compliments of Obamacare. Newborn babies cannot be added to Obamacare insurance plans. Other life changes, including marriage, divorce, or death in the family, also cannot be updated on healthcare.gov. So, can this get any worse? The answer, sadly, is yes. Joining me now, private medicine advocate and Obamacare expert Patricia Newman. Patty, let's go back to that. There was a study done regarding Medicare patients and their use of the ER. This has the potential to just overburden emergency rooms across the country.
Right. Actually, this study was for Medicaid patients.
Yes.
Right. And this was done by the journal Science. It studied that this group of patients in Oregon, there were about 25,000 patients that won this lottery to be covered by Medicaid. And then they started following these patients to see their utilization of services. And they found that their utilization of the emergency room was 40% higher than the rest of the population.
And this is important because a lot of folks, the majority of the folks going to healthcare.gov are signing up for Medicaid, not Obamacare. And so this is going to flood the system with new Medicaid participants and like I said, potentially just overwhelm emergency rooms across the country.
It is a vicious cycle. It's actually very dangerous for the patients. And really, even those of us that oppose this whole Obamacare thing, we don't want people to hurt because of this new system. The patients are uninformed. The biggest problem, however, is the lack of participation of physicians. Because the reimbursement is so low, these doctors cannot afford to take the patients. So you have the lack of participation. You have patients that are trying to find a family physician to take care of a simple problem. They can't find it. They end up in the emergency room, overutilize the system, and then we have the cost of treatment of these patients being somewhere around 26% higher than another patient because it's just such a vicious cycle.
So these new people in the system aren't going to be able to find doctors that can see them in a timely fashion, so they go to the emergency room instead. Now, there's also some astounding numbers regarding Medicaid patients and their post-surgical recovery, or on the flip side, their death rate versus people with private health insurance.
Right. This was pretty astounding. It was a study done actually a couple of months ago, or published a couple of months ago. It encompassed over 800,000 patients. They were followed up from 2003 to 2007. And it was a really good study done comparing the outcomes for surgical procedures on patients that had different coverage or no coverage at all. So they compared private insurance company versus Medicare versus uninsured versus Medicaid recipient. And the numbers are horrific for those that have actually any of those other alternatives, but the worst are for Medicaid recipients. So the death rate for a patient that has Medicare is 54% higher than a privately insured patient. The uninsured, the death rate is 74% more probable than a privately insured patient, right. And Medicaid is 97% higher.
That is an astounding number, 97% higher than if you had private health insurance. So right. How do you account for this? Is something as simple as not as good medical care because the doctors who participate in Medicaid are not up to snuff?
It's not necessarily that the doctors are not good. The problem is the small number of doctors that do participate, which makes the system shrink. So you have this huge pool of patients trying to shuffle them in through, a few providers that can take care of them. I mean, here in the county where we practice, I gotta tell you, in the North County, I was just told by an insurance representative, a provider representative, that in North County, they only had a handful, you can count them with one hand, of physicians that participated in this Obamacare Medicaid program. How are you going to put tens of thousands or perhaps hundreds of thousands of people through 5 providers? This is going to have the same effect. This is why the death rates are higher.
So where is all this headed? At some point, is the government going to issue an edict, and it's going to come out of the White House because Congress would never do it? Are they going to say, hey, all physicians must participate in Medicaid?
I hope it doesn't go that way. I think that the majority of physicians will not be pushed that way. They are more likely to quit altogether than be told what to do. So this is...
But that's a problem, too, because we're going to lose doctors.
Right, right.
It's a mess.
It is. I think the best solution is for us to behave, all of us. Those newly insured people need to be responsible. They need to recognize when they really need services. Try not to overtax the system. I don't want it to succeed. I'll be honest with you. But doing it the other way and just showing up because you have a newly minted card is not a responsible thing.
And it's horrible because people's lives hang in the balance here in a very real sense. Patty, thank you.
Thank you.
Coming up next, where it's legal in the U.S. to get stoned, as the Daily Ledger continues.